Thanks very much. That was very enlightening. And we've now got the opportunity for all of the questions to both Leanne and to Anna, who's coming up. Now, I am looking at my phone because I've got the questions from people who are online as well. So whilst others are coming up to the... I'm going to start off with one of them from an online question, and I think this is probably to you, Anna, actually, but what is the Guild doing to standardise vaccination practice through pharmacy on a national basis, e.g. national framework based on age and type of vaccine?
Yes. And yes. Yeah, of course, they're advocating. I mean, a huge win to the Guild for us, I'm assuming a pharmacist has asked that question, the NIP has been expanded under the federal budget announcement, so that was a huge win for pharmacy because I think coming back to that access assumption, you know, that's a huge question I get all the time. You know, vaccination hasn't gone up. You told us if we opened it up to pharmacy, vaccination rates would go up, and I truly believe that once we take out those complexities, we will start seeing that shift. So the Guild are advocating very hard, the PSA are advocating very hard, so I see it from both sides. And my hope is that now that we do have that national funding, it kind of makes sense to have another roundtable. They had a roundtable a couple of years ago where the states all came together, and my hope is that that's on the agenda again soon. And put me in the room. I'd love to be there.
Thank you. We'll go to from the floor.
Leanne, thank you for your talk. Sadly, you'll have to change your Indigenous pneumococcal slide because it's going to be 25 in a month's time for that. I'm glad to see you use the immunisation as your audit CPD. I've been pushing to try and get that done. It's a really simple way of getting those points in general practice, but it's used very rarely for that. I saw the recent report about government dissatisfaction with the PHN's performance. They're going to bring out new guidelines. We used to have immunisation in what were then called by a different name, the pre-PHNs. With the PHNs now, there is no requirement for them to be involved in immunisation. It's off to chronic disease and mental health and so on. I wonder if it's possible for the college and others to push for PHNs to become the leader of coordination of such activities as using your audit for immunisation and reporting processes without that, because I think that is a really great way to coordinate GPs in a certain area to be doing more in immunisation and actually focusing on their data moving forward.
I first got into immunisation through what was a division of general practice and GP Tasmania, and your PHNs have dropped that off there. It's not one of their core functions, unfortunately, anymore. But I saw that excellent work that we saw earlier from New South Wales in aged care, and I think there's a real role for that, for PHNs being involved in immunisation and facilitating that general. And I think when the numbers went up and we had the air, they dropped the ball there and said, well, we'll move on to something else. But yeah, I have very little to do with my local PHN now, which is very disappointing.
Thank you. We'll take from your question from the floor.
John, just by way of background, context of this question, I was for 20 years the Deputy Chair of the Quality Committee of the College of GPs, and we produced the Red Book, which is the Guidelines in Prevention Practice, which is evidence-based, and I wrote the first 2 editions of the Green Book, which is evidence-based implementation. And my question, when we have a new program, it's good to focus on all the benefits, and I think you've done an excellent job from that. But I think we need to remember Donald Rumsfeld. There are known knowns, there are known unknowns, and there are unknown unknowns. And whenever anyone conducts a large randomised trial or looks at a new program, they're very cautious to look for unintended consequences. So like with vaccine, we're often looking for things like Guillain-Barré syndrome. I think there are 3 that potentially apply to pharmacy, and I'd be interested to think how that's actually going to be rectified. So the first one is continuity of care. So while there is an opportunity to provide a vaccination that's there, prevention is a much bigger topic than that. And with the generalist knowledge of the GP, there may be something that the GP gets a sniff of when they see a patient for another reason. And so those loss of opportunities for vaccination is potential. We can't say what there is. I know a lot of GPs now will only focus on one problem when you come in and won't tackle anything else. But the potential for loss of continuity and fragmentation of care is one issue. The second one is quality control. And I can give you 2 examples. I've had more than 10 GPs in South Australia, Manurung based and otherwise, where they've actually got a story of an adult elderly patient going in for their flu vaccine in April and being offered the standard dose influenza vaccine because that was what available, and the adjuvanted vaccine wasn't. And the adjuvanted vaccine is the one that the person should be getting, and they actually got administered the standard dose of that. And then finally, the challenge in a pharmacy environment is that while you do have guidelines around prevention, there are a lot of products that sit within the pharmacy that don't have a randomised trial evidence base to say this will actually produce a particular impact. It may make people feel a bit better, it may ease symptoms. So it'd be interesting to think about the guidelines, because when people go into that environment, not only are they getting evidence-based products, but they are surrounded by a whole lot of other things of which some don't have evidence. So I'd like you to comment on how will the Pharmacies Association look at monitoring those things there to see whether these things would actually happen. And to be really candid, they happen in general practice. We recognise that. And we also recognise that not every GP does a sterling job, but there is a process of accreditation and review to try and make sure that they're actually maintaining a minimum standard.
Well, first of all, what are you doing? It sounds like you could come work over with us. You've got a good CV there.
I'm retired.
There you go. You can always, there's always a number. Can we name it? Look, it's nothing, there's absolutely nothing that you've said there that obviously we don't come across. And it's the same thing, there's obviously in every profession, there's gaps in experience, there's gaps in knowledge. I guess when I'm coming at it from a lens of alignment is, as a senior pharmacist, when a junior pharmacist makes a mistake, there's different ways you can approach it, and we can shame them, we can say they don't belong, we can make their time hard, or we can mentor them and we can support. And I think there is a bit of a change in the air where once upon a time a GP would ring and grill a pharmacist and really just say their piece and hang up. But the most positive interactions that I'm now seeing is when that GPs are really open to collaborating and raising up pharmacists as immunisers. So to answer your question, yeah, I mean, everything, we have so much that we could learn from GPs, and I believe the industry's really open to it. And I think there's a real, a conference like today, this is a huge opportunity for the different professions to come together, and for people that have been vaccinating for 30 years. I mean, I vaccinate. I haven't been in my pharmacy for about 4 weeks. All I've done is vaccinated for the last 4 weeks. I've been all over the country. I still know that if I sat and talked to you for an hour, I'd learn so much. So I think I can't really speak from the guidelines. Peter, who's out on the phone there, who's conveniently out, he's the head of policy at the PSA, so I would have loved to actually have thrown him that question, because he would have been able to. I don't want to answer something that I don't feel is my role to answer. But I do think that, I think instead of us trying to think we've got it all together, all professions, GPs, the same as what you said, there's some GPs that need some support as well. I think that's why when I stood up here today and said, we do need I was being more authentic with you. I'm not going to pretend that, every pharmacy you walk into, there's a consistency of care. That's the standard. That's what we need to be working towards. Something I'm really passionate about, and have over the last 12 months has been one of the things I'm trying to use my platform in this role to do, is to actually call out pharmacy and say, hey, you want to stand up and you want to own this lane, you've actually got to stand up and you've actually got to come to these types of events, you've actually got to commit to the training. we do have accreditation. I do think our governance is okay, but I would love to sit with you and hear all of your ins and outs. And as an industry, we need to be open to that because that's how you grow. So thank you for your question. And I think we can get you on the staff.
Thank you. I'm going to take a slightly different tack. I'm going to take one from the online before I come to the floor again. But this one is for Leanne. Whose responsibility is it to have visibility of resident vaccination status, the aged care facility or the provider? It's an important first step in preparing residents for vaccination.
So could you just repeat the question slightly? I'm just a little unclear as to who's responsible for recording this vaccination or who is responsible for finding out if they need it?
I can only read it as written. Whose responsibility is it to have visibility of resident vaccination status? The aged care or the provider? Sounds to me maybe both.
Yeah. I think under the new guidelines, it's a requirement that the facility is aware of their vaccination status. And certainly when I have anybody who even goes for respite, I'm asked to provide a health summary and a list of their immunisation status, which I usually print off air because it's usually the most, it's official as such. Hopefully mine matches the air. But all my residents, one of the first things I do, particularly if I take over a resident that's come from out of town and I don't know, is I go to them my health record and look on air and find out what they've had. Are they due? Because particularly if they're coming in March, April, they're very unlikely to have had an influenza vaccination. So that'll be the first thing that I'll have to be providing.
Just to add to that, under the new Act, it's a responsibility for the homes to have live governance. So they need to be able to. It's more around their control and prevention. So their standards. So essentially, what happens is when they have an outbreak, they need to use vaccination live data to make informed decisions on how they're going to manage that. Right. So you can offer a whole nursing home COVID, right? And they can all decline under the Act. It's all about that access. It's then how the aged care homes use vaccination rates to inform how they're going to manage infection control and prevention. So I've spent a lot of time in this space. But so they need to be at any time able to pull that. As providers, of course, we're responsible to be checking air to make sure it's safe for them, but it's not our job technically, although what I do, we do, but it's not our job to then maintain that in our brain to know who's due or not. That is ultimately with the facility.
Thank you. Thanks for your patience. Take your question.
Thanks for the presentations. They're really, really great. I'm Claire. I'm from the Royal Brisbane and Women's, so I've come down to the cold today. I just wanted to, so I work in multiple roles at the Royal Brisbane. I've been there for a few years now, moving up from Victoria. And so I work as a midwife, so we provide maternal and newborn vaccination. And I also work in the staff vaccination space as well as a nurse immuniser. I'm very passionate about immunisation. But I wanted to come up to really give a shout out for pharmacists, because I just, in both my professional and my personal life, I just find pharmacists are just absolutely brilliant. So on the floor, working in a postnatal ward space, our pharmacists are very diligent and look in air for all our pregnant mums who are admitted, and a lot of them are very complex, high-risk, acute women. So they always check their air and then they highlight if they're due for vaccinations. And that's really, really helpful because it's a really great way to capture those women and who are often very complex and often have quite significant mental health. A lot of them are homeless. So it's really great to be able to capture them. So our pharmacists do a great job in that role. As a nurse vaccinator as well, so staff, family members, visitors, people in the hospital, we send to the local pharmacy downstairs to have vaccinations. So when they ask about their whooping cough, or we heard there's measles, or we just send them down to the pharmacy and they take care of them. So that's fantastic. And then as well, from a personal perspective, I have complex medical health and I go to my GP regularly, but I feel like my GP does a lot for me in terms of care plans and complex health, and I don't see immunisation as part of that space for her to provide that. So I go to my local pharmacy. I have a great relationship with a couple of the pharmacists there, and they do all our vaccinations, and they do the vaccinations for the family as well. So we all go to the pharmacy rather than going to the GP. So yeah, I just want to really give a shout out for pharmacists because they're really fantastic. So
Yeah, no, thank you. That's really, they've turned me off. That's how they know to get me off the stage. Thank you. Yeah, we had a great kind of first year in that maternal space. I think pharmacy was sitting about 14% of delivery of the Abrysvo, so that was really great. We're hoping, to keep doing that. And I think, we are genuine when we say we want to free up the GPs, because we can't do a lot of what, GPs can do, and we're just genuine in that we feel like there is a real opportunity for collaboration of healthcare here, and if that's something, to hear your experience is really encouraging. And, it's like anything, it takes time, it takes investment, it takes that unity, but I do think, I think it's really great, and thanks for the comment.
Thank you.
I'm going to do one follow from the online questions here because I think it's relevant to that. It's focused towards yourself, Anna, but you might both have a comment. How do we solve the problem of a general practice that does not have visibility that one of their patients has recently been vaccinated through pharmacy? The practice spends unnecessary resource contacting patients when the answer comes back, I've already had my flu vaccine. This is happening more and more.
Yeah, it's usually the other way. Normally we say the GPs haven't. Usually we tell you guys off. That to me is just that they've failed to use their software, because my experience is every pharmacist, our software is now built in that you're recording the interaction. So if you don't press complete, it sounds administratively, but it sounds like this is an issue. If they're writing a comment in a conference, then it's obviously something that's recurring. My experience, and I don't know any other pharmacist that operates any different, is that we're checking air as we go and our software is literally doing it. So I'm not sure is to answer that, because I would say that I feel like that's something we do well. Obviously not.
I mean, I would say that is one of my biggest delights about AIR, is it now interacts with the software that I use, which is best practice, but I think it would integrate with a number of the others. Now, at this time of year, I will open up a patient's file, particularly if they've come for a chronic disease management plan and influenza vaccination is part of it. There'll be a little thing up the top telling me influenza vaccination is due. Before I've actually gone to get the patient from the waiting room, I've clicked on AIR through my immunisation tab, and it'll tell me that they had it at the pharmacy on, the 15th of April. I'll actually enter that in, because that'll make that thing disappear from the top, and that I'll know that they've actually had it. So it does rely on the fact that it has gone into AIR, but I think that those of us who have got software that actually is instantaneous, which it wasn't in the beginning, it was much more complicated than that. And I went and did some workplace vaccinations. As part of their form that they completed, had their Medicare number, and my practice nurse entered them into AIR manually, so they probably weren't in there for a couple of hours, but unlikely these guys would have left the workplace to go to the pharmacy to have a vaccination. So
yeah, and I think the other thing, and I'm not exactly sure how your reimbursements work with Medicare, but for us to get paid, we have to press that complete button. So that's just part of our workflow, because we don't have to then do a separate, it's all just magic. So.
Well, we don't actually get paid for the encounter.
Anything.
Yeah, we get paid for the consultation.
That's right.
Such.
So I'm not sure how that. Yeah. But for us, it's very much you press complete, and it goes one way, and it goes the other way, and then magically it pays the rent.
Marianne Williams again, sorry, from SORCAN. And my question, with the news, the childhood schedule potentially coming on with pharmacy now, you've got a 6-week-old that's presented to you for immunisations. You've done them successfully. Would you recommend, would you have discussion about them having seen their GP at that stage? Would you recommend that they did?
So it's an interesting one. I've been thinking about this a lot, because I was talking to Angela actually before, because I think this is a space that pharmacy will need to be heavily refreshed on before it goes live in that NIPVIP space. I was reflecting on my own experience of motherhood, and vaccinations sat separately to maternal health appointments for me. So my understanding, again, I am getting older now, but my kids are around 10 and 8, but, oh no, they're 12 and 10. But, don't tell them. I guess of course, my thing would be is tell me about your maternal health check. So for me, that would be the question, and that will be part of the training that we're reminding pharmacists. But my experience was that I went to the local council and there was no weighing, there was no anything there. It was very much you turned up with your green book. Do we still have green books? There you go. And it was all documented there. So I think our challenge will be to make sure that they're in that system of seeing their maternal health nurse, because surely they were like my life support during my early weeks. And I would want that more, just forget the baby, the mum, she needs the help. So yes.
Yeah, I just think, I think the great pros and cons of both presentations this afternoon, but I think, like in a lot of Aboriginal communities, they don't have access to child health nurses, and what we're doing now is training our practitioners and nurses to do ASQ track milestone checks, and they're at the immunisation encounter, 2 months, 4, 6, 12, 18. Autism, as we know, is high in Aboriginal children, so it's so important that they continue to get their developmental checks alongside their immunisations. So I just think for that, the area, the people that I work for, it's very important that we continue to have the milestone checks, not just the vaccinations sitting separately.
I think these are really helpful things to look at now, which is so great, because as we are developing and upskilling pharmacists in those areas, like these are key things that you're aware of, you know, so these are great things to bring forward. There's no reason that, you know, pharmacists can't be involved in upskilling and doing courses and making sure that they are across that, or making sure they're really connected. You know, again, we're coming back to that alignment, you know, and making sure ultimately it's the patient, and it has to be that patient-centred approach and what's best for that individual patient, not what's best for the industry that's providing that service. And I think it's as long as we keep coming back to that, and as I said to you before, every solution I come up with is provider agnostic, because it's not about the provider, it's about who the solution is being designed to solve, what solution is being designed to be solved.
Thanks. I'm going to finish this off with one very quick last question from our online group, and I'm going to limit you to a 30-second response each.
You're looking at me.
Okay. Nurses vaccinate individuals all the time. If they were reimbursed, the vaccination landscape would change even more than GP and pharmacy alone.
Preach
Any
it.
comments?
I think I'll take that first. I mean, that is one of the problems in general practice. There has to be an involvement of the GP in it for it to be able to be billed to Medicare. So it would be wonderful if we had a nurse vaccination item number, which in fact we did, and they took it away from us. So
Alignment.
I think we're all in agreement. That's a great way to end the session.
I'm getting
Thank
a
you very
t-shirt,
much for
alignment next year.
the questions and also from the responses of our panel. We're going to break for tea, but before you run off, I do need to ask you to please be back by 10 to 3, because we do need to set everybody up to do the workshops. And unfortunately, we do at this point have to say goodbye to our online guests, as the workshops can't be run through the online process, but the findings will be, from the 4 workshops, will be written up and shared with everyone in the next few weeks. So quick nip off to go and get your cup of tea and back for the workshops. Thanks very much, everyone. Thanks very much to our panel.